Let's talk about ketamine for anxiety. While most of what we know about ketamine comes from the studies to treat treatment-resistant depression, ketamine also has been proven to significantly reduce symptoms of anxiety as well. The strongest area of study in the area of anxiety disorders lies within the framework of PTSD and secondarily social anxiety disorder. While we can look to the research for some hard data points on why ketamine can be helpful for anxiety, we can also talk a bit about the well-documented but not always well understood relationship between anxiety and depression. We like to call these two diagnoses dysfunctionally related, as one can often beget or cause the other. In the context of anxiety, what we typically observe is some maladaptive pattern of thinking that often leads to behaviors of avoidance. In many scenarios, these behaviors of avoidance often lead to the classic criteria of depression, which can include lack of motivation, isolation and withdrawal, and diminished interest in activities that were previously pleasurable or preferred. Ketamine has been known by some as the great pattern disruptor. People often find with repeated exposure to ketamine in a treatment setting, they find themselves with a newfound perspective on the world, and in many cases, finding different ways to view and thereby solve some of their problems. Ketamine can allow different parts of the brain to communicate and can actually make therapy more meaningful and effective. It is important to note that while ketamine-assisted psychotherapy is the best way to maximize the positive effects of ketamine on the brain, concurrent psychotherapy outside of the ketamine treatment room can be significantly helpful as well. As a part of our ketamine program here, we're happy to educate and coordinate with outside therapists of how to best integrate ketamine therapy into their work with a shared patient. Learn more about our ketamine program by clicking below.